Hello and welcome to Tail Talkz. In this episode, we'll be speaking with Dr. Prashant Channe. He will let us know how we can help stray kittens. So let's dive into the subject and get his expert opinion. What should be the first steps when someone finds a stray kitten?
First step, when we find a stray kitten, basically we have to check whether the kitten is having any injury. Second thing, if there is any discharge in the eyes or if the kitten is very weak. So basically what happened, if the kitten we found, she has been abandoned or he has been abandoned from mom, so you will see lots of dehydration is there, because basically mom cleans the kittens. Or if sometimes what happened, if there is an attack of any male cat, then also the injured kitten, we will see the injuries outside. Basically the urine part and the motion part area is soiled. So whenever we get all these stray kittens, first of all we check the eyes, we check the back part of that, and we check for any injuries of the kitten.
How can you determine if the kitten is truly abandoned or if the mother is nearby?
Main question is that when there is a abundance, the kitten is very weak, because when the kitten is with mom, the kitten is healthy. So, and we will see that the kitten is little bit dehydrated, and there is a very we say small insects over the body, because the mom cleans the kittens very well, and the abandoned kittens, because they are negligent, so they are very weak. Weakness, we can say that it is abandoned.
What should you feed a stray kitten if it is very young?
Yeah, so basically what happened, we are having some formulas, ready-made food. So it is known as first stage milk or milk replacer. So we calculate the body weight, we divide 5 to 7 times a day according to body weight. We give small quantity of that milk with some gripe water, because basically what happened, if we give directly, so they get stomach bloated. So lots of kittens we are losing because due to too much of food. Second thing, it is a proper hygiene thing. If you are not being hygienated, and then the kitten, they get infection from ourselves. So we have to take care that we should give a proper amount according to body weight and intervals. That means if the kitten is very small, so you can give 5 to 7 times a day. So we add that ready-made food.
How do you safely introduce a stray kitten to a new home?
Basically the main question is that basically animals, they are smell specific. So when they are weaned or when they are separated, because when they are very young, they are with the mother and the siblings. So when you see the mother is there, the kittens, they go inside and they suckle the milk. So they sometimes they are very much entangled with the siblings. So when they are weaned, they always make some sound. They will meowing, because they are separated. So if you hold the kitten in your hand, she will try to go inside this side or she will go inside. So the best thing is that you give proper bedding. You just wrap the kittens, and if you are having your old clothes, so we make small that rectangular type of things, you make small cushions, and then you place the kitten there. Because what happens, they need something. If you keep the kitten in the box, she will start screaming, she will start meowing, because there is separation. So the best thing is that you make a small bedding of your old clothes, because the animals, they are smell specific. So if they are getting the smell of your, so they will be very cool and calm. So best is soft bedding, because it is a new place, and always keep the kitten in a cool and calm place, because they are very shy, they are very scared if there is lots of sound, lots of light. So best way, keep in a small box with this that old clothes, and make a soft bedding, and then you can keep it.
What are the signs of illnesses or malnutrition that a rescuer should look out for?
The main thing is that when you get the kitten, you should check that there is a dehydration or not. You just peel the skin. If it is dehydrated, the skin will come upside. Second thing, the eyes will be having mucus. The third part is that they are having it tucked up, that the abdomen is gone inside. Basically when you see a small kitten, the stomach is like this, rounded. When they are undernourished, when they are not having proper meals, so the stomach goes inside, and when you peel the skin, there is a dehydration. The third thing and the last thing is that they are having lots of parasites over the body. So parasites means they are having infection. The fur is not well. You will see that there is a rough uh, coat. So it indicates that the kitten is sick and weak.
How can you help socialize a stray kitten so that it is comfortable around humans?
Best question is that when we get all these things, first you have to keep the kitten for at least 22 to 72 hours with a small kitten, or you can keep the small beddings. Because what happens, the trauma what they get in that last time, so if any male cat has been attacked, or the small kitten, other cat they attack, or it is been separate from the mother, so there is a trauma. So to reduce the trauma, we always advise that to keep the cat in a soft bedding and with the small other kittens. If you're not having the kittens, then you just keep the kittens separately, give a soft bedding and proper care.
When should you take a stray kitten to a vet, and what are the most important health checks?
The first checkup is the dehydration. Second thing, if there is any mucus in the eyes, that means some disease or infection is there. And when you see the kittens, you just turn the kitten, you will see lots of fleas over the body. So whenever there is a fleas, they get worms inside. So the kitten gets loose motions, because lots of kittens, when we are giving them milk, they are lactose intolerant. So immediately they get bloated abdomen and they get loose motions. So we have seen that lots of abundant cats, they are hypoglycemic because no food, no milk, so they become dehydrated and hypoglycemic. And whenever there is a hypoglycemia, there is a low temperature, subnormal temperature, and there is a stunted growth. Pot-bellied appearance, that means the stomach will be bloated like this. It means that they are having worms. So the coat is not good. You will see the parasites. So when there is parasite, so when the kitten try to lick it, the parasites, they are having small eggs larvae, and they hatch into the inside the body of the kittens, and they get tapeworms, or they can get these roundworms. So first you take to the vet. Whenever you see if there is any discharge in the eyes, small fleas, or sometimes what happens, there is a fracture. So when the cat tries to take the kitten from one house to other house, sometimes if there is any dog or any cat, they leave them, and sometimes they get injured due to attack of the dogs or the cats. Sometimes what happens, we have seen a small human kids, they play with the kittens, they throw them, because when they try to hold, there are the small nails. So when they try to hold the small kid, they throw it, or sometimes they try as a toy, so they play and just throw it. So sometimes the small kittens, they get injured. Sometimes what happens, some kittens, they are fallen from some heights, because while traveling with mother, sometimes mother drops them. So any accidental injury, that means the basic injury is bite marks. Second thing, fleas, parasites, and then any discharge in the eyes, because sometimes what happens, when the kitten is 2 months, they get these viral infections. So when the kitten is weak, mother leaves the kitten, because she knows it is a survival of the fittest. So it is a law in animal kingdom that if the kitten is not well, so the mother leaves the kitten. Or sometimes accidentally, when she is moving from one place to another, the kitten has been abandoned. So whenever a rescuer get all these things, please first visit the vet, and thoroughly he will check up, he will take out the parasites, he will give some medicine, because as soon as you get the kitten, you can't vaccinate them, because they get under stress condition. So first 2-3 days we just under observation, anxiety, stress, we give some multivitamins, and then further. So best way is to visit a veterinarian, he will definitely help you.
What is the vaccination schedule for a stray kitten, and what are the mandatory vaccines?
So basically, when the first thing is that we have to deworm the kitten, and at the age of 2 months, that means 6 weeks or 8 weeks, we start the first vaccination. So first vaccination is basically tricat, which is having three vaccines. That means panleukopenia, sometimes it is a calcivirus, then herpes virus. So we are having different companies, just like we are having 2-3 companies. So basically, it is known as tricat, three vaccines. So first shot we give at the age of 6 weeks or 8 weeks. Then at the gap of 21 days we do the booster of that. Same vaccine has been repeated. Then the third vaccine, which is on the basically the third one, we are doing the booster of that tricat, and we give the first vaccination of anti-rabies. So again after 21 days we give the last shot of anti-rabies. So total 5 vaccines are there. At the age of 2 months we start. Before that we have to deworm the cat, because before immunization we have to take care of that the immunity, because vaccination means immunization. So immunity develops when we are giving proper vaccinations. So these tricat and anti-rabies, these are the vaccines which have been given at the interval of 21 days, and then we repeat after 1 year. That was annual vaccination for lifetime.
With the current epidemic in Maharashtra, what are the precautions that a cat rescuer should take?
Basically, we have seen that lots of cats or kittens, they are coming with a complaint of high fever, no appetite. Then we have seen that there is a discharge in the eyes. Some are having vomiting, loose motions. So when we are doing the tests, so we are seeing that when we do CBC, we are seeing that low WBC count, which indicates a viral infection. So for proper diagnosis, we are doing RT-PCR test. In some cases, we are seeing that calcivirus is there. In some, we are seeing just like cat flu. Basically, cat flu means respiratory problem. So some cats are having mucus in the eyes. Some are having loose motions. So when we do the RT-PCR test, we are seeing that lots of viral cases have been there. So mortality rate is high because we have not been vaccinated. So because vaccination is the primary key to take care of that. Because so best advice is that all the cats or the kittens should be vaccinated. So because vaccination prevents from getting all these viral infections.
And are there any vaccines different for a breed cat and a
No,
stray cat?
no. Basically, all these vaccines are the same. We are using for stray cats, we are using for Persians, we are using for these top breeds. So the same vaccination, but we are having different companies. Some are having some different strains. So we are having basically 2-3 companies, big companies. So we are using Tricat and anti-rabies for the vaccination of this.
Are stray kittens at a higher risk of catching diseases during an outbreak, and how can we protect them?
Yes, sir. Basically, what happened? The main thing, key factor is the hygiene. Basically, what happened when they are with mothers? So they are having these parasites, ticks, fleas. Second thing, they are not having proper food. Undernourishment is the second part. So if the kitten is having very low immunity, there are high chances of getting viral infection, because immunity is the main thing. If the kitten or the mother is not, because if mother is having 5-6 kittens and some babies, they are not getting proper milk, so they get undernourished. So nourishment, hygiene and immunity is very important. So we have seen that lots of cases that stray cats, they are having these chances of getting more as compared to these household cats.
What happens if I take a whelping mother home? Will that help a pregnant cat in some way?
Basically what happens, foster mothers, basically we say foster mother. So foster mothers means sometimes what happens, they are not having proper milk, or sometimes what happens, the kitten dies and she is having milk. So these mothers are not foster mothers. And whelping means after giving birth to the kittens, and sometimes basically we have seen that 12 to 15 days is needed for a kitten to open the eyes. So that period is very crucial. So basically the cats, they never go out at that period. So they take care of the kittens until and unless any trauma or any attack of the other cats happens. So whelping mother, yeah, we have to take some care that if she is having, so we generally advise to give some immunity boosters, oral suspensions, some calcium, because when the mother is having babies, so there is a low calcium, so they should not get hypocalcemia. So we always advise to give some calcium and some multivitamins to the whelping mothers.
Thank you for that informative session with us, and surely we'll come back to you again
Thank you.
for the
Thank
next
you.
session. Thank you.
Faricias is elated to be a part of this educational series as a partner with AFF. Hey everyone, this is Kautuk Pampattivar, founder of Faricias, a brand dedicated to all your furry friends. Thank you, Absolute Feline Fanciers, for considering us in your journey to educate the community.